How has life expectancy changed in Southeast Europe? Imagine a world where people live longer than ever before. Now, picture how this shift affects entire communities and countries. That's what we're exploring today. In Southeast Europe, life expectancy has been on the rise over the past 100 years. Back in the early 20th century, many countries in this region had average lifespans well below Western Europe. Poor health care, limited sanitation, and economic struggles kept people from living as long as they could. But things started to change as public health improved. Better hospitals, vaccinations, and cleaner living conditions helped reduce early childhood deaths and infectious diseases. Throughout the 20th century and into the 21st, life expectancy steadily increased across Southeast Europe. Between 1990 and 2011, most countries saw consistent yearly gains. However, after 2011, the pace slowed down. Some nations even experienced setbacks. Economic problems, health system pressures, and external shocks like the COVID-19 pandemic caused temporary declines. As of 2023, the average life expectancy in the European Union, which includes some Southeast European countries, is around 81 years and 4 months. Women tend to live longer than men, with women in the region often reaching into their 70s and 80s. For example, Bulgaria, one of the region's countries, has seen some of the biggest recent improvements at age 65, but still has one of the lowest life expectancies within the European Union. Hungary also reports lower figures compared to Western Europe, mainly due to differences in healthcare access, lifestyle, and economic stability. The COVID-19 pandemic caused a sharp, though temporary, dip in life expectancy across Europe, including Southeast Europe. Some countries experienced a decline of up to 1 year or more. The good news is that since then, life expectancy has started to recover. Still, the pace of this recovery is slower in Southeast Europe because of ongoing health system challenges and economic difficulties. Longer lives bring new challenges. As populations age, there's more demand for healthcare and social services. Many countries face the problem of shrinking working-age populations because of low birth rates and young people leaving for better opportunities elsewhere. These demographic shifts put pressure on public budgets and labor markets. Governments are working to improve healthcare, promote healthier lifestyles, and create policies that support older citizens. Factors like medical advances, better disease prevention, and healthier habits have helped increase life expectancy. But the region still faces higher rates of preventable diseases like heart disease and cancer compared to Western Europe. Lifestyle choices such as smoking, alcohol use, and diet play a role. Economic instability and unequal access to health care can slow progress or cause setbacks during crises. Looking ahead, Southeast Europe's future gains in life expectancy will depend on continued investments in health and social systems. Addressing social inequalities and improving healthcare access are key. The COVID-19 pandemic has shown that health progress can be fragile, and resilient health systems are vital for protecting longer lives. In summary, life expectancy in Southeast Europe has grown significantly over the past century. But recent years have seen slower growth and some setbacks. Demographic shifts like aging populations and migration will continue to shape the region's future. To ensure these longer lives are healthy and fulfilling, policymakers need to focus on health care, social support, and economic stability.